Happy Tuesday. Dr. Abby here. I am sitting outside getting some sunlight, so I have been sneezing like crazy, so I apologize if I sneeze. I'm going to try not to. I moved out of the sun a little bit, so hopefully I will not. But I came on today to do our weekly live series that we do on Tuesdays. I'm going to talk today about primitive reflexes. So there are 7 well-known or commonly known primitive reflexes. They develop and become present either in utero or in the first few months of life, and most of them, no, actually all of them, should fade away and no longer be around anywhere between 2 months and about 2 years. Most of them, the majority of them, actually should fade between 2 months and about 6 months, but there are a few that can stick around to 9 months or even, as I said, about 2 years. So they should all fade away, is basically what I'm trying to get at there. And a common example, a well-known primitive reflex, is called the rooting reflex. And it is when you gently tickle or kind of stimulate a baby's cheek like this, and they'll turn their head towards that side. And the reason they do this is so that they're preparing, or they're assuming that they're going to be nursing. So they will, if someone is breastfeeding or bottle feeding their child, and they're having a hard time, like the baby just woke up or is kind of fussing or something, and you want them to just take the bottle, you can just tickle right there and they'll turn towards that side and actually open their mouth in preparation for latching. So that's one of the ones that most people know of. But as I said, there are a few others that are commonly known and commonly understood as being a primitive reflex. As I said, all of them should fade within the first few years of life. When a primitive reflex does not fade, it is something called a retained primitive reflex, which I've mentioned briefly in previous episodes, or lives, or whatever you call them. And as I said last week, I believe it was, I'm going to be talking more about them, even more than just today. I'll probably do some more videos on them. And the reason I'm going to be talking about them so much is because when you have a retained primitive reflex, you can potentially be labeled as a problem child, or even adult, or kind of the weird kid, or someone that, just is slow or dumb or something, right? Which I hope we all know that those are just horrible labels, and typically they come from the problems or the weirdness is coming from somewhere else. And sometimes it can be a retained primitive reflex. These can present themselves with the kids that are wiggly and just won't sit still in their chair. They're constantly shaking a leg or moving around or leaning forward and sitting back in their chair and just will not sit still. This could be the kids that have poor motor development, so learning how to write and hold a pen or pencil is really hard for them, and they may just refuse to learn to read or write. They may have a hard time tracking things with their eyes. So if a teacher is constantly moving around in front of the room, or they're trying to play tennis, things like that, they can have a hard time with that and become kind of fussy, or just zone out and not pay attention, and then not learn things because they're stupid or dumb, Luckily, a lot of times we don't really label kids that way anymore, but it definitely used to happen. And they still sometimes get these labels. Some other ones are going to be just, they startle easy, they scare easy, always very overwhelmed, a meek personality. Those are going to be kind of our weird kids that just don't really talk that much. They're very quiet and they have a kind of strange personality. All these things, right? I mean, there's so many. There are whole books about this. So there are lots of examples. But the common ones, as I said, are going to be the ones that wiggle a lot. They won't pay attention. They talk a lot during class. They get distracted. They want to get up and move around. They just are bad and disruptive. And the reason that this is happening more often than not, as I mentioned, are those retained primitive reflexes. And what's happening inside of their brain essentially is they're getting so much stimulation because of these reflexes. Their nervous system is on like overload, and they're just so overwhelmed, and they're doing these things to try and quiet that overload, that overwhelmness. They're trying to calm it down and like distract it a little bit. So they do these things like wiggle to try and have some different input. They may rock to try and change how their brain is perceiving things and kind of distract things. There's all these methods that they'll do to try and change that stimulation. And it's actually completely fascinating, and something that I'm so passionate about. And the really amazing thing is that when you are trained and you know how to identify these retained primitive reflexes, you can help these people. And a child that never read, or would get headaches, or would complain of headaches or their eyes aching when they were trying to read, would all of a sudden be reading 5 books in 1 week and just be like absorbing so much information. With these kids that cannot sit still in class are all of a sudden sitting and focusing based on these really simple, to be honest with you, exercises that you do at home and in our office. So there are some amazing things that can be done. They can definitely be helped, and the evaluations are super simple, and most of the time the therapies are also super simple. It's really great actually, because especially when it's little kids, you can kind of just approach it like you're playing a game with them, you know? You can make it fun and make it enjoyable and not make it a challenge or a chore, because oftentimes these kids already feel like they're a chore because they're constantly getting fussed at, or being told that they're bad, or being told that they just need to be quiet, you know, and all these things. So if you just kind of make it fun and make it a game, it's something that can really help. And we're going to be going over some of those exercises in the future, some of those evaluations, more specific reflexes, some of the common ones that are retained, and how you evaluate for them, and how you can help kind of rehab those, do some therapies for them. We're also going to be offering a monthly, like once a month, like workshop or class, playtime. We're kind of still figuring out the name we're going to call it, because the main thing is that it's going to be fun. But it's going to be a way to kind of demonstrate some of those therapies and games that you can play at home with your kid to help get over these retained reflexes and kind of beat them and help these kids out. And I keep saying kids, but as I mentioned in the beginning of this video, you know, a lot of times they go untreated, and you can have an adult walking around with these things, and the therapies are still going to be very similar. The only difference is that instead of having a parent potentially do it with you, you have enough understanding to be able to communicate what needs to be done, and you can do them yourself. But yeah, there are plenty of adults as well that have these still. And these are going to be the adults that, again, were labeled as problem children, and they've had to work really, really hard to get over some of these kind of hitches that they have, right? The hitch in your get up, that they're having a hard time, and it kind of limits them in school, and they've had to work really, really hard to overcome that and to learn things. So it can definitely be adults too, but if you catch it in your child, obviously it's gonna, you know, set them up for a little bit of an easier school experience, and just get rid of it a little bit faster. But yes, I'm super excited to educate people on this topic, help evaluate anyone that may or may not have some of these reflexes, and answer any questions about them. And I'm really excited to offer that class. It will be starting here soon. We'll announce it obviously in a little bit more detail once we have some of the details hashed out a little bit. But I'm really excited to do that because it's a fun way to help with motor development, neurological development, these retained primitive reflexes, sensory development, all these things. So it's going to be for everyone, not just people that have retained primitive reflexes, but of course those that have retained reflexes are going to benefit greatly from it. So I'm looking forward to that and to answering any of your questions. So have a wonderful Tuesday. Get out in the sun a little bit if you can before it rains tomorrow. Good old Colorado in the winter, spring. We love the rain. We need the rain. And get out there in the sun. And if you have any questions, comment them or send me a DM. And I look forward to answering your questions for you. Okay. Have a happy Tuesday, guys. Bye.